Welcome to Mind Myself, another live event, a mindful health discussion. Time is precious, and you have chosen to come here today, or you have chosen to watch this recording after the fact, and we are so grateful that you are here with us. I'm Esther. I'm the founder and CEO of Mind Myself, and today we are talking about balancing act, integrative approaches to bone and pelvic health. And one of the questions we're going to be talking about is, why do we even need to talk about this subject? But it is one of the really important health topics of our lives as human beings. And before we jump into that, I'm going to just do a few housekeeping items and welcome you all here. First of all, Mind Myself's vision is about cultivating unity, especially in times of divisiveness or diversity. And our goal is to help you feel seen and heard and supported on your health journey as you become your own best health advocate. You know your body better than anybody else. And even if you feel like you don't, having that information come up to you and be able to recognize it and work with it is one of the goals that we want to help you with. And congratulations on prioritizing your health. Not everybody does, and you're here. So that's you doing that. I'd love you to take your hands like this, if you feel so inclined, and give yourself a pat on the back. Yes. So thank you for being here. And I want to thank my team. Wendy, as always. Wen Hao, thanks for being here. I couldn't do this by myself. This takes a team. And in the chat, we are very interactive in the chat. I would love it if you would put your questions, what you want to get out of this session. If something occurs to you as you're going along, we do monitor the chat, and our practitioners are going to monitor the chat as we go along too, so you never know what kind of answers will come out there. A land acknowledgement. I feel privileged and blessed to work, live, and play on the ancestral, traditional, and unceded territories of the Semiahmoo, the Katzie, the Coquitlam, the Kakite, and Tsawwassen First Nations. And I'm just so grateful to live where I live in the world. And of course, no discussion on health would be complete without a disclaimer. So here it is. All the information and advice from Mind Myself and the practitioners is for general education purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information here and on the Mind Myself website should not be used to self-diagnose or self-treat medical conditions. We always recommend that you consult with a doctor or other qualified healthcare practitioner for individualized medical advice on specific medical issues. The views and values of each practitioner do not necessarily reflect the views and values of Mind Myself. So I'm taking a little deep breath here together and just letting a few more people come in. And let's take a breath together. Take a breath into the count of 3 and hold it for 3 and then release for 3. I always find a breath helps me get present. Our bones are living records of the challenges we've faced, the triumphs we've celebrated, and the endurance that defines us. They are silent storytellers of our journey, and they hold us in place. The National Institute of Arthritis and Musculoskeletal and Skin Diseases says, bones support your body and allow you to move. They protect your brain, heart, and other organs from injury. And we're going to jump into a juicy, rich conversation with our 3 practitioners in a moment. But I would like to take this opportunity to have our practitioners introduce themselves just briefly so that you have a sense of where they're coming from and what their passions are. Dr. Vicky, let's start with you.
Hi, I'm Dr. Vicky Munlock. I am a recently retired OBGYN/wellness physician, And wellness means many things to many people, but wellness in my world was, how do I keep people off of medication, out of the hospital, out of the system, and feeling their best? And I would tell my patients, if you're in the right office if you want to feel forever 15 to 20 years younger than your stated age, and their jaw would just drop. So I did regenerative medicine, traditional medicine, complementary alternative medicine, and energy medicine as my way of doing that for patients.
Thank you, Dr. Vicky. Karen, why don't you introduce yourself, please?
I'm Karen Angelucci. I'm in South Surrey, British Columbia, and I love helping you move, feel, and live better in your body at any age. I really hate that people are struggling with symptoms and discomforts because they're not getting real health answers for their real health concerns. And so it's I'm a Pilates practitioner of 30 plus years and currently an osteopathic manual practitioner. And so I really want to help people find their way through that maze of what to do to feel good, look good, and live to a good old age.
Fantastic. Thank you, Karen. Dr. David.
Hi there, I'm Dr. David Hardy. I'm in Red Deer, Alberta, but I've also practiced in Asheville, North Carolina, and then Cleveland, Akron, Ohio. And I am a chiropractor, a functional neurology clinician, some functional medicine, and a podcast host as well, and guest speaker. So basically what I do is I take people from pathology and performance, and I look at ways to hack the brain, nervous system, and other systems in the body to get people better and functioning at a higher level. Absolutely love it, and excited to be here and speaking with you.
Thank you, Dr. David. We are thrilled to have this discussion together. Let's kick it off with the question, why is it so important to be talking about bone health, specifically bone and pelvic health? Karen, would you start us off?
Really, one of the main things about talking about bone health now is that osteoporosis is a silent disease. And if you don't start to understand the value of your nutrition, your exercise, lifestyle, have a sense of your genetic predisposition, the silent killer of or disease of osteoporosis creeps in on you, and you don't start to know that it exists until you break a bone or you fracture something really important and your life is altered completely. And in regards to pelvic health, gosh, our bone structures in terms of walking are totally reliant on our mechanics through the pelvis, through the hips, through the spinal column, and of course the nervous system. So we want to make sure that our hips and pelvis are mobile, and there's many reasons why it can become immobile, and I'm sure we'll talk about all those things as we progress.
Absolutely. Dr. David, why is this such an important conversation from your perspective?
It's amazingly important because it is a reflection of how every other system in the body is doing and your general health and longevity. If you were just given the question to look at someone and see, are they healthy or not? And the things you'd look at would be posture, facial expressions, affect, and yeah, kind of that vitality with how they move and how they're standing, sitting. Is it slouched? Is it structural? And it just gives us a wealth of information just by observing. And then when we dive into all these different systems and how it affects and is interconnected, you'll really be awoken to this vast knowledge of how everything's interconnected and how we see it in different systems that will reflect another system, and instead of the siloed approach that's being given to us in healthcare.
Absolutely. Thank you. Dr. Vicky.
Well, and you guys have all said it in different ways. So if I can kind of say it in a slightly different way, it's about balance. You know, bones help us with every function in our body. Bones are a repository, if you will, of a lot of our calcium. So are our muscles. So are our teeth. But what happens in calcium balance is that we hit times of both injury. We hit times where we are incapacitated by, name whatever disease that may change your activity level. And now we're relying, instead of balancing how our calcium metabolism works, we imbalance our calcium metabolism. We may pull more from our bones. We may pull more from our muscles. We may pull more from our teeth. And menopause is one of those natural events that happens with women, that we lose our estradiol. That's what helps us absorb calcium. And so that gets thrown just automatically, without you having anything to do with it, into an imbalance that many times you have no awareness. As Dr. Karen said, you just have no awareness that your bones are getting weaker or thinner until you go to do something you normally would do, pick something heavy up, and all of a sudden you fracture. Or you put your hands out to stop yourself, and normally that wouldn't be a problem, but now you fracture your wrist. Or you fall backwards, and normally you would pick yourself up and keep going, but now you've fractured your tailbone or your spine. So the silent disease, as it was so aptly said, we don't get a lot of warning signs. So we, as our own health advocate, have to give us the warning. We have to go looking for, is this a problem? Because medicine likes to wait until it is the problem, so they can come charging in on their steed with their sword drawn. I will save you, damsel in distress. Well, we should never get to that point. We shouldn't be there. We shouldn't need that knight on a steed. Tell him, go away, Don Quixote. Go find a different windmill to look at.
That's right. Is it? And it would be a pharmaceutical sword. So that, but that's
There
a whole
you
other
go.
conversation.
There you
Instead of
go.
a sword, it's a needle.
Hey,
there you go. Off to a great
You
start.
said it. You
Yeah.
said it, Dr. David.
Why? So this, we hear so much about bone density. Why is that the first topic of conversation, and what does that actually mean, and how is it tested? Dr. David, why don't you start us off on that one?
Yeah, traditionally, and this is why it's called the silent disorder, but I'm going to explain why it's not so silent as well, is that, yeah, traditionally it's waited until somebody looks frail and you take an x-ray. And if the density on an x-ray is decreased, then they've got osteoporosis. And well, it takes roughly about 30-40% decline in the percentage of tissue in the bone before it's actually shown on an x-ray. So it's completely incomprehensible to think that this degenerative process that's occurring all the time can't be measured until you're down 30-40% of your density. And then, yeah, there's other diagnostic and imaging tests that can be done to show it. But yeah, there's subtle signs that, yeah, when we get into posture and breathing and calcium, that we can see right away in people. And it's going to start to show us kind of this decline before it gets to that 30-40% on an x-ray. So yeah, there's a lot that you probably notice that will actually point in this direction of decline in these systems.
Thank you. Dr. Vicky, what do you think about bone density?
Well, bone densitometry is what I always considered the classic test to do, which is using two very low dose X-ray waveforms, if you will, and you're looking at the L1 through 4, the lumbar lower spine, and you're looking at the hip to give you an idea of, are you from a L1 through 4 spine looking at the upper part of the body versus your hip looking at the lower part of the body. Yes, you can do a foot scan. There are other ways to do it, but the gold standard, quote unquote, is the bone densitometry. But what gets lost in the shuffle besides menopause is people that are on certain medications. And I know we'll get to medications later, but people that are on steroids in particular, or any kind of a gastric reflux medication, those are the two biggest ones that can be so disastrous and can actually change how your calcium metabolism works, changes that balance in how your bones are able to equally absorb and resorb, and it goes more into the resorb of bones. So you start getting, weaker, and almost think of it as you're punching holes in your bone, and some of the major structure is still there. But if you break the wrong structure that's holding amongst all these holes, you're going to have a collapse of bone or a break. And most people have no idea that's coming, but there are certain, as Dr. David said, there are certain warning signs and certain warning medications that we really should be more aware of personally, as well as the practitioners taking care of you.
Thank you. Karen, any thoughts on bone density from your perspective?
Yes. So again, they were talking about the bone density, the mineralization in the bone, and then the mass of the bone. And so some other warning signs for that can be loss of height. So if you start to notice that you're shrinking a little bit, or your partner says to you, gee, when we hug, you're a little bit lower than what you used to be, that's an indication that the spinal column is changing. And so there might be some compression and loss of structure in the vertebrae. There may be low back pain. You might be having pain in that. Because of the structure of the spine, you might have a more shallow breathing, or not as capable of taking a full breath, because your structure is changing and you're not able to let the lungs expand when you take your full breath. So those are other signals that your body's telling you something is going on, and you need to be investigating if you're suffering or struggling with any of those types of symptoms.
Thank you. And now let's jump into the hormonal conversation. And I know many of the people on this call are women, and I know that hormones affect men too, but let's talk about what happens with hormone changes in menopause and how they affect our bones. Dr. Vicky, this is your passion. Let's get you to start this off.
Oh, thank you. Thank you. Well, as I alluded to, we do fine when we are in our menstrual career, basically puberty, age 12 and a half, to average age of menopause, age 50. But what we don't do well with is once we hit menopause, and it's different for every woman, but we make hormone, kind of think of a bell curve, and we make hormone from 12 and a half to 50 like this. But when we are below, and especially above, we aren't making hormone. Our ovaries will continue to make testosterone, believe it or not, but we do not make our cyclic female hormones of estradiol and progesterone. But our body will make estradiol, but it's taking some of our body fat, our estrone, and converting it to estradiol. So will it be enough to help us absorb calcium from our GI tract? Rarely, because you need a level of 30 in order, by blood test, and checking it by blood test, you need a level of 30 to be able to absorb calcium from your GI tract. So you may not have that level of 30, which your body then goes, well, shoot, we need calcium. Where are we going to get calcium from? Well, the bone bank. Okay, I'll go to the bone bank and I'll just take a deposit out of the bone bank. Well, that works for a while until your bones have so many holes in them because you made so many withdrawals from your bone bank that they may also start pulling it from your teeth. And then, oh my gosh, now you suddenly have problems that you're needing teeth pulled and bridges put in or implants. And many times this will take different women different lengths of time to get to, but there is not a single woman that I met between the age of 65 and 70 who walked into my office saying, I don't know what's going on, but I've got either tooth issues or I've got height loss issues, or I don't feel good. And that I don't feel good has symptoms in every part of your body, but realize that if you're going to be, one who is blessed with longevity, you live to 80, you live to 90, then you're spending from 50 to 90, 40 years without hormone when you spent 40 years with hormone. We're asked as women to spend as much time without hormone as with. Who designed that? Well, God designed us, of course, or whatever God you believe in, but realize man gave us the ability to give us longevity to our life. So we have to be able to either find a new way to work with how our body works, or realize that some of the old ways, like relying on our body's hormone, maybe isn't so bad. So hormone replacement is what I would do with my patients. Women who have breast cancer that's hormone sensitive, there are, and I hate to use the word pharmaceutical, there are some pharmaceutical things. There are also some natural things that you can do. So realize there are options, but you at least have to realize that you may be spending as much time without what makes us women versus what we had when we were making our own hormone.
Thank you, Dr. Vicki. And before we jump to Karen, we'll bring you next. We have a number of podcasts recorded with Dr. Vicki about hormones and the 4 legs of the hormone chair, and how we can dive a little bit deeper into those. So definitely take note of that. Karen, do you have any thoughts about hormone changes, menopause? And you're muted, so maybe unmute yourself there.
I was busy with the chat there, and I kind of missed all of what Dr. Vicki said. So hormones and bone changes. Let me come back to that because my brain is
Okay,
scattered
fantastic.
there for a minute.
That's okay. Dr. David.
I love this topic, and I love how Dr. Vicki there was saying a bone bank, because yeah, calcium is supposed to be in the bones, but it gets leached out into the system. And there's so many different ways it can, but let's go back to the hormone system and then kind of integrate that with it. Is that the major hormone in the human system is going to be for energy, our insulin, our blood sugar, and our cortisol. Now, men have the advantage of bigger body structures and mass due to extra testosterone. And it's our go forward kind of hormone in our system. Whereas in women, cortisol is used a lot more. And cortisol dysregulation is going to change that inflammatory response and our energy systems. And when that happens, then we start getting leaching of calcium out of the system already. And it's accelerated then in menopause. And 2, if the system doesn't have enough energy supply, if we're run down, stressed out, inflamed, then what happens is the other hormone systems don't work, because the body doesn't care about sex hormones when it doesn't have enough energy to get up and move during the day. And if this deterioration and imbalances start to happen before menopause, then it is going to be a perfect storm when menopause hits, or when you take the wrong medication. And all of this is reflected in kind of those inflammatory responses, the puffiness, appearance, the lack of blood flow in the brain. And then 2, what happens in stress is posturing. And well, we get that stressed out slouch posture. And we see this in women later too in life, that stressed out posture turns structural. You get that hyperkyphosis in the back too. And then what happens too is the breathing changes. It's that stressed out hyperventilation, muscles in the neck, upper back, and that change in the curve, change in how the ribs function. And what that does is it changes the blood pH. And the easiest way to change the blood pH from a different environment is deep, relaxed breathing. But you can't do that if you're stuck like this, hyperventilating too. And then if the breathing isn't working well, the blood pH changes and more calcium gets leached out of that bone bank as well. So it's kind of this perfect spiral of one thing affecting another and downward spiral. What we want to look at is, well, how do we get more of an upward spiral year after year so that longevity happens and the process isn't as quick to accelerate when we're in those different phases of life.
Excellent answer. Karen, I would love to maybe shift into the pelvic floor health conversation with you then, unless if you want to talk about hormones, feel free.
I do just want to make a brief comment in as much as the glands within the body are really responsible for making osteoblasts and osteoclasts. So that's what is forming and reabsorbing and breaking down the bones in the body. So if you're looking at the glands, we're looking at the thyroid gland, we're looking at the production of cortisol, so the adrenals, the pituitary, the testosterone, and the production of, I'm not sure if it's luteinizing hormone from the ovaries are producing osteoblasts, and the glands are all contributing in some way. So in osteopathy, we talk about structures govern function. If those glandular structures are being compressed because of injuries or posture, or you've had concussion or surgeries, you've got scar tissue, you've got things that are not allowing the blood to deliver those hormones, you're going to have bone problems. It's going to eventually result in bone problems because your body's not able to perform the jobs it needs to do. Hopefully that makes sense.
Thank you. Yeah, totally. And maybe shift right into that, Karen, with about pelvic floor health and strength. And I know you referred to it at the beginning, but how does pelvic health specifically, the pelvic floor strength?
So pelvic floor health. So first of all, pelvic floor muscles attach the pubic bone and to the tailbone, and they are like a hammock, and they contract and they support the pelvic organs. So in relationship to your bladder, your uterus, your bowels, they're all being suspended in that hammock in the pelvic bowl. Those muscles are also attached to the rim of the small pelvis. And so it's important for those muscles to be able to contract and release so that the hips can move properly and the SI joint can move properly. And how that relates also to health is that in terms of if they're not functioning properly, those organs can prolapse. They can fall basically out of the body, which, if you will, and very uncomfortable, very distressing, incapacitating in many for some people if it's a big deal. I'm not sure what else you asked me at the moment, but
no, that's good. That's great. Okay. Thank you, Dr. David. Pelvic health and incontinence or prolapse. How is this all related to our conversation today about bones?
Oh, big time. Just like I described the posturing up top when we're in that different zone, that flexor posturing, that hunched over, slouched, stressed out mode, decreased breathing. What we have is tight flexor muscles and weak extensor muscles. And the same thing's happening lower in the skeletal system. So if we're breathing up here too, that's less breathing from the diaphragm. Well, the major diaphragm attaches to the lumbar spine, and there is a motion with the ribs, with the whole spine from the tailbone all the way up to the top of your skull. Now, if the flexor muscles are too tight, extensors too weak, we see that very easily in the upper body, but we also see it in the lower body. So diaphragm's going to be a little weaker, but lower abs get weaker. The top of the thighs, our hip flexors get tight, and our glutes get weak. And then we get this kind of distended belly as well because our lower abs aren't working. And what does that lead us prone to? Well, in athletes, you're going to see more herniations if that posturing occurs because the lower abs aren't in the right position. A weaker diaphragm is going to result in, once again, that oxygenation not working well. A weak diaphragm, though, is also going to be related to the pelvic diaphragm. And all of those muscles are connected and work in unison for every movement we do when we're walking and every breath we take. And yeah, we start to see these imbalances, and it's usually worse one side versus the other, that flexor tone versus extensor tone. And then year after year, things start to decline more and more as they're used. And then two, all of these muscles are controlled by the nervous system. A muscle is a dumb piece of protein. The tone of it is controlled by different pathways, and the postural pathways tell us about how the brain's working as well. So there's two major pathways there, the descending pathways that inhibit flexor tone, and then the balance pathways that bring up that posture as well. So not only is it a result of, different tones, stresses on different muscles, different joints, and the bones remodel over year after year too. So then, the hip and the angle of the acetabulum or the femur is going to change with different tone and posture year after year, decade after decade. And then too, all of this is being controlled by other systems that tell muscles and joints the position to be in.
Excellent. We'll get to the joints and the muscles in a moment. Fantastic. I know any one of you could talk for an hour on any one of these questions. Right. So great. Dr. Vicky, any wrap-up comments on the pelvic floor from your perspective?
Well, a lot of women would come in and say, well, I've had babies, so that's why my bladder is falling. That's why I'm incontinent. That's why I have trouble with my bowel movements, and why I have a pooch. I had C-sections and they cut my muscles. Well, I would gently remind them that muscles usually aren't cut. It's usually that there is less recovery of those muscles to their original state. But yes, the stretch that a lot of those very fine pelvic floor muscles undergo are rarely able to be rehabbed back unless you're doing your Kegel exercises daily and you're doing them for a set period of time. Even if you only do it once a week, which most women will rarely do, Kegels, you can't bring in your abdominals. You've got to let your pelvic floor do the work. And most people are never really taught how to do that well. So while we have that pelvic floor relaxation, that's an imbalance, as David said, of both your flexors and your extensors. So you may feel pelvic floor prolapse as pain in your glutes or your lower back. You may feel it as pain in your upper thighs when it's really referred pain that's coming from your pelvis and prolapse. And even guys who have prostatectomy or have any reason for prostate surgery, they'll have an imbalance that occurs with them as well. And many times incontinence, women have to do the same Kegel exercises that we have to do, even though they didn't have babies. Theirs was a surgical issue. But yeah, hormone also plays a huge part in the muscular strength, the ability for us to maintain that muscular strength and to be able to keep our joints healthy. Every single part of our body relies on hormone. And in guys, it's the testosterone. In women, it's our estradiol progesterone balance. And I totally agree. The 4 hormone groups have to be in balance, and menopause in particular throws that balance right out the window.
Great. Well, Dr. Vicky, if you would jump into the next question, which is about joint health and arthritis. We hear a lot about arthritis and achy joints as we age. So how is that? How is arthritis and joints? How are those related to our bone health conversation?
Well, itis is always an inflammatory type of expression. So You can have arthritis, you can have bursitis, you can have colitis. So you can take any organ system and add itis to it, and it's inflammation of that organ. But in the pelvic floor, itis or any type of inflammation of the pelvis, but now joint, arthritis is that cartilage or anything that helps make the integrity of that joint painful. So many things get labeled arthritis that may not be. And many people will say they have joint pain when really it's muscular pain being referred to a joint. And so there are many people that will then go to an orthopedist and say, I have pain in my knee. They'll do an x-ray and say, oh my gosh, there's imbalance in the cartilage in your knee. You see this 199th percentile over here, that's bone on bone. Oh my gosh, that's where your pain is coming from. You need a cortisone shot or you need a joint replacement. And it's like, whoa, 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 hold the fort. You know, arthritis is an imbalance. If you think of a cartilage, it's usually a nice even disc, if you will, of cushion in your joints. So it's not bone on bone. But if with time, and David said it beautifully, our hips start to spread, or we change our pelvic balance, you may put more stressors on one part of a cartilage than another. You may have been a runner, you may have torn some cartilage. So you may have done some wear and tear unevenly in a joint that's going to give you pain, but a acute pain versus a chronic pain, they'll all be called arthritis. Then there's autoimmune arthritis, like rheumatoid. So, you know, arthritis, again, is an inflammation of that joint. Hormone is a part of helping it. Regenerative medicine and being able to put growth factors and proteins back in to allow your body to orchestrate the rebuilding of cartilage is a phenomenal way to rebuild spot areas that are out of balance and give you back your vitality and actually help rebalance and give you back joint health.
Thank you, Dr. Vicki. Karen, from the Pilates and osteopathy perspective.
Just refresh the question again, so I'm on track.
Yeah, joint health and arthritis.
Mm-hmm. Joint health definitely relates to posture. It relates to alignment. Both of those can be affected by surgeries, injuries, muscle imbalances, chronic like mispatterning of firing in your body. So your weight distribution is different. So you kind of more wear and tear on a joint. You got cartilage breaking down in that joint. Again, as Vicki talked about, you're going to get an arthritic, an inflamed condition when if there's tension in a muscle, the blood is not being circulated the way it needs to deliver nutrients, to take away the waste products. Your lymph is not going to be able to function in those areas because of muscle tension. So it's an accumulation or a compilation of having the joint be in good alignment and getting the nutrients that it needs and having the biomechanics of the muscles to be able to move that joint properly. So you're looking at nutrients, you're looking at mobility, you're looking at alignment for joint health. Yeah.
Excellent. And I have a question for you before we move to Dr. David. Since we're sitting here in our chairs, can you give us an exercise right now that would help us sit better or more effectively? Can you just give us something really simple right now?
Oh, okay. Well, you can. I like to do it standing, but you can, if you're in a hard chair, it's going to be easier, something with a hard surface. Put more weight on one sitting bone than the other.
Okay.
And feel that weight. Feel in your body. Don't think about it. Actually breathe into it. Now put your weight on the other cheek or the other sitting bone. And then notice, is it easier to be on one cheek than the other? Does it feel, oh yeah, I'm used to sitting on this side more than the other side? And you may or may not I'd be curious to know if anybody notices that, but if you're in a soft surface, you can't necessarily notice it. So now you're going to allow yourself to have even weight on the sitting bones and allow the spine to be like building blocks that are just stacking easily on top of the weighted surface that you're of the ischial tuberosities of your sitting bones. And your feet are evenly placed on the floor. And you take that relaxed breath in, like you're breathing in and opening the rib cage like an umbrella, allowing this abdominal area to relax, and exhale it out the top of the head so that the breath is a natural occurrence of filling the lungs and expanding the ribs and relaxing the muscles. And again, as Dr. David said, you're encouraging that parasympathetic response, which is your healing rest and digest mode. So taking a moment anytime.
That's really cool. Something so simple as shifting your weight from one side to the other a
And
couple
then
of
finding
times, and then finding
the center.
the upright alignment with ease, and take a breath. Cool. Thank you so much. Dr.
welcome.
David, on to the, for you, just a little tiny bit on joint health and arthritis.
Absolutely. I think most of it's been covered. Yeah, you have the stress, chronic stress of basically the different posturing movements and that whole system and process. And then on top of it, you've got the different immune inflammation responses. So one is kind of fuel and the other is fire. So if you have both going on, that's when the chronic pain conditions seem to come out more. Just having arthritic or stress changes are going to usually be less painful without the inflammatory response as well being overactive. But we commonly see both, especially in modern day lifestyle. So yeah, simple things like posture exercises are going to help. And then, yeah, you have to look at and diets, nutrition on top of everything else.
Hydration, hydration. Everybody take a sip of water. Okay, and Dr. David, I know
Yes.
you have a specialty, if you will, on cognitive health and the bone-brain connection. So why don't you start us off on that? What's the connection? Bones and brain? Really? I know it's housed in bone, but talk to us about that.
Yeah, absolutely. A lot of it's going to be those postural systems that come from the brain being able to know where the body is. And if it's run down, we're going to go back into that flexor type posturing that we just see epidemically out there. Like, yeah, you can say, sit up tall, be confident. And the thing with posture and breathing and all of these is it's involuntary till we think about it. So yeah, we can give ourselves all sorts of crap that we're not doing the right things, but really it goes back to what Victoria was saying is we're just not training people on how to exercise and rehab these systems properly. And a lot of to posture, once again, is balance, which is the fastest pathway in the human nervous system. It's the one that's going to go awry first in disorders like MS, because it is that big, thick extension cord going from our brain to our body. And it's working so fast and involuntary that it's really the foundation for all the other systems in the body. And yeah, balance is connected to blood flow, and posture is connected to that. If we move forward, our brain has to calculate that and then shunt blood appropriately. So people that get dizzy standing up or moving in different directions too, which happens commonly, those systems are connected. And it's that computer up top that's telling us involuntary, unconsciously what to do. But we can train that if we do the right exercises and stimulate the right parts of the brain and then support it metabolically as well.
So I'm hearing you say we think better when our brain is supported properly with good posture. Like
Absolutely.
That's pretty basic, and
Other
we
way,
don't think
other
about
way
it.
too is that we can determine how the brain's working by posture.
Wow,
All these
amazing,
lines. Absolutely.
phenomenal. Thank you. Dr. Vicky, your thoughts on brain health and bones?
Well, I'm going to take my cue from you, Esther, when you said that we had prior podcasts with the balancing the 4 hormone groups. So thank you for that marvelous lead in, because, you have to have for your body in all organ systems, but especially your brain to work better, and especially to do this and reverse Alzheimer's and prevent it. You need balance in your 4 hormone systems, your female, male, your adrenal, your thyroid, and your insulin. Those 4, if they were out of balance, you are at extremely high risk for this. And Alzheimer's is called diabetes type 3. So that's a really intentional sugar connection, which this country has a major problem. Most civilized countries have a major problem with excess sugar in their diet and not enough exercise to wear that off. So, but we do know that with menopause in particular, in men who have dropped in testosterone to below their age appropriate levels, will have very similar pictures of brain fog, short-term memory loss, forgetfulness. And they come in and they go, I'm losing my job because I can't remember the name of a customer over and over in front of my boss. And I've got a 25-year-old I have to train in my job because I can't keep my brain functioning the way I used to. We give her back hormone and bam, she's hitting on all pistons because we've balanced the 4 legs of her hormone chair. So it's hugely important to realize that hormone is a part of the foundation of everything that happens in our body. And it's the time progression that we tend to lose track of what this balance is, or that balance gets thrown off for us, that we have no choice, menopause, and we have to act to get that balance back.
So much to learn, and there are some questions in the chat. You may wish to address those too, Dr. Vicky, or we can get to them later too. Karen, the bone-brain connection from your perspective.
So tenets of osteopathy are the body has the ability to auto-regulate, and the body is a functional unit. So Dr. Vicky and Dr. David have all been talking about all the different systems and how they are interfaced and intercommunicating. And so in knowing that your body is a functional unit and it has the ability to auto-regulate, as Dr. Vicky was saying, by introducing, and each person is different, there's no one size fits all. So it's very important that each person starts to take a proactive understanding of what their needs are and who to go to. So then that they can address, is their issue nutritional? Is their issue, posture? So many people are on their phones with the tech neck. That's going to definitely affect their
The tech neck.
It's going to affect their brain function because of blood, because of neural pathways being strained. So we have to start understanding that, as Dr. David said earlier, that we're not siloing our symptoms. That what is the root cause of the issues or symptoms that a person is experiencing, and being able to find a practitioner that can guide them. And it may not be one, they may have a number of systems because our bodies are in a functional unit. The systems are communicating and responsive to one another. So when you give your body what it needs, it auto-regulates. It auto-regulates around negative things too, but we don't want to be in that. You don't want to be working at the lowest level. You want to be giving yourself the nutrients, the good mental messages, the hormonal balancing to start optimizing how you are functioning for the long term.
Absolutely. I love this. And there are so many great comments in the chat, and I've been tracking the questions, so we will ask them for sure. And no No topic of discussion on health would be complete without discussing nutrition and supplementations. And one of the most recent questions in the chat was, should we supplement with calcium? And if so, what kind? Let's talk about nutrition and supplements here. And Dr. Vicky, I'd love you to kick us off on that.
Well, that's kind of a double-edged sword, because people will say this type of calcium versus that, but all of it's irrelevant unless you can absorb it. And I'm going to say that again. That's irrelevant, what type of calcium, unless you absorb it. So you need to have a healthy GI tract, but even with a healthy GI tract, you need an estradiol level of 30 to be able to absorb it. So you need to know where your hormone levels are, or this just may be a moot discussion. Now, there can be a false elevation of calcium in your bloodstream because you're pulling too much from your bone bank, your bones, or your teeth. So you also, as Karen so eloquently said, you have to know all of your root causes of where things may be coming from. What medicine wrongfully does is say, oh, you have a high calcium or a low calcium, let me take care of that for you. And they ignore the rest of the problem, and they don't go to the root cause. They simply, quote unquote, throw something at you and say, here, this should take care of it, without any follow-up. And then you go to the next practitioner who goes, oh my God, why were you doing that? That's thrown this system off. So Western medicine has kind of lost its way as far as how the system of the body works as interactive versus, as David has said and Karen have said, the siloing of you take care of this system. Then, oh, you have a side effect that's causing this system. Oh, I have a pill for that. Oh, that's causing this system to go off. Oh, I have a pill for that. But now we're back to square one and nothing has gotten resolved. So we have to take charge of our own health and realize we have to know how our body works. You need to know where your estradiol level is. You need to know if you can even absorb the calcium that you're taking. You need to know if your gut is healthy. So to me, calcium is important, but there's other steps you have to know first. Diet balanced, of course, but there are different body metabolic types that some are going to respond better to a higher carbohydrate, some respond better to higher keto and lipids, others respond better to higher protein. So you have to know how your body best responds. And, I could reverse osteoporosis patients in my office with not only proper diet, good sleep, but an estradiol level of 30, weight-bearing exercise, and then calcium. You have to have all three, but your estradiol level of 30 is huge. It's key.
Wow. So I'm hearing that loud and clear. Really, the message is, if your hormones are balanced, those four legs of the hormone chair, then you can start to address some of these other issues.
Right.
And we are,
cause.
yeah, exactly, at the root cause. And of course, what we put in our body and our food is important. And I know in the chat, people have been asking about calcium and magnesium and the relationship of that as well. Dr. David, can you talk a little bit about nutrition and maybe some calcium, magnesium in there from your perspective?
Yeah, and I first got to applaud everyone here for diving into such a heavy topic, because this question really exemplifies what healthcare is like. Is that, yeah, if you got an issue, throw one solution at the multi-level problem, and calcium is that. And what they found was, when they started giving calcium supplements in high doses with other things that are needed, like magnesium in the system, is you got increased dementia. Mm-hmm. And, well, how many middle-aged women are walking around with migraine disorders? Migraines, if you have too much of an imbalance of calcium in the cell versus outside the cell, then you get excitotoxicity, and those neurons fire way too much. And then you get migraines. And probably later in life, that's going to burn out, and dementia cases go up as well. So saying it's just calcium doesn't get to the root issue of the problem, and that's why calcium is not where it's supposed to be in the body. And to make it maybe simple on this energy side of things is calcium is a positive charge, and we want positive charged in the outside body. Okay, and that's why calcium is drawn out of the bones into the body when it's needed to raise positives. Inside the cells, we want negatives. So oxygen, proteins. And when there's that imbalance between in the cell versus outside the cell is where we have these imbalances. And it's like, give me something to change that so that those cells aren't flooded with being in this soup of inflammation and acidity that it shouldn't be in. So instead of just asking, okay, what calcium I should take, you should be asking, okay, well, how to make this whole system healthier? And yeah, things that are going to make it healthier are not too complicated if we start early and just go with eat real food.
Eat real food. That's your number one first thing.
Stay
I
away from
love
the
it.
processed junk and
Yeah,
keep it
eat
simple
real
that
food.
way. And then if something starts to go wrong after that, then you can dive deeper. But
Okay.
the first one, yeah, stay hydrated, eat real food, the positive ion foods with high nutrients like your vegetables, and you're going to be doing a lot better than, yeah, all the processed junk that leaches calcium out of the bones and increases inflammation and decreases our energy, our hormones, our brain function, our bone density, all of that. So
Thank you, Dr. David. In our last couple of minutes of this first hour portion, Karen, just your perspective on nutrition and calcium, magnesium, etc. And then I have a short invitation for people.
Well, magnesium and phosphorus help to distribute calcium in the body. And calcium is stored in the bones. Like 99% of our calcium is stored in the bones. And its function is immense in terms of what it contributes to. It keeps our tissues rigid, strong, and flexible. It helps our vessels dilate and contract. It's related to our muscle function, blood clotting. Calcium is super important. And the imbalance of trying to take calcium to supplement is, I believe, going to lead to problems, as Dr. David was saying, within, giving you kidney stones or brain dysfunction. You want to regulate, and your body knows how to regulate calcium. So it's important to get it through food, is what I believe as well. A good balanced nutrition is important.
Thank you. What a fascinating and in-depth discussion on what might have been perceived as a boring subject, but so not a boring subject. This is so interesting. I'm going to take a couple of moments now just to shift gears quickly before we get into our Q&A section. And I'm going to share my screen. And we're going to have a really quick invitation to something here. You from the beginning. We are all about helping you become your best health advocate at Mind Myself. And our next event coming up on May 3rd is going to be about cancer. And I have Dr. Vicky will be with us again, so you will be hearing some more wisdom from her. And we have two other people, Lisa Roche and Christine Toner. And I'm calling this an uncommon cancer conversation. This isn't just going to be the usual things that you might hear, because cancer's everywhere and everyone's talking about it. But we want to talk about it from a slightly different perspective, and in particular, through a lens of beauty and what you can do if you've had that diagnosis or you know somebody in your world. And I hazard a guess that most of us have been impacted and knowing somebody in our life who has had cancer. So this is going to be a really valuable and important conversation. And it's Friday, May the 3rd, same time as this, and finding beauty through the cancer journey. If you sign up for that today, and it is complimentary, as always, If you sign up for today, you're going to get your name entered into a draw for either this blanket, which is a $50 value, and it is a flannel. It wraps up and has a closure here, but it's also wonderful for picnics because it is waterproof on the bottom. Prize being given away is this fantastically handy recycled, it's a cooler bag made from recycled materials as well. And so I will be delivering those in anywhere in the continental United States or North America. And the other giveaway is a 1 hour or longer session with Bill Chalmers. He's on this call today. He's a fantastic coach. And it's actually a priceless value. He's been coaching for over 50 years, and that's a huge offer. So if you sign up today, you will be added into the list of people and into the draw for this, any of these prizes. And ways to stay engaged with Mind Myself, we would love it if you would go to visit our website, check out a podcast or a blog, of course, share this recording with other people, read our monthly mindful moment, sign up for our newsletter every month, and be a part of our community and tell us what's going on in your mind and your thoughts. And of course, to keep Mind Myself going, we would love it if you would be willing to donate some money. That's fine. To take us to the next level, we've been doing this self-supported for about 3.5 years now, and would love your support. Or if you feel like you want to donate to an organization called Blind Beginnings, that is a local British Columbia organization that helps children and families whose children are blind or sight impaired. And they do fantastic work all throughout the province. And then there's also an organization called Ways of Transformation, and it's in Uganda. And they help young women access period products. We take that for granted. We go into a store and we can buy whatever we want. Those young women and sometimes older women just don't even have access to that. So those are 3 ways that you can continue to give back. And I will stop my share now. Thank you for being here with us today. And we hope that you will stay to the next part of our conversation, which is the questions and answers. And I know there are a number of questions that have been flying fast and furious in the chat. So I'm going to start us off with one of those. And if you have a personal question you want to ask a practitioner, please feel free to raise your hand and we'll get you to ask that live too. And the first one that I want us to talk about is from Katharina. She says, I'm almost 73. Should my estradiol still be 30? Dr. Vicky, would you please respond to that?
I'm going to say yes, but I'm not going to take you from 0 to 30 in a short period of time. You would hate me, okay? Or you would hate the practitioner doing it for you. Like everything, you have to do it in stages where you can tolerate the increase, but you still need to get to that level of 30 in order to have calcium absorption from your GI tract. Again, what I would see in women is not just osteoporosis, but I would see them having their teeth literally disintegrating in their mouth, because that's another bone bank or calcium bank, is they would take it from teeth. And so I had a woman walk in and said, well, doc, I weathered menopause just fine, but I'm facing a $40,000 bill because I have to replace every tooth in my mouth with an implant. So I don't know if I can do this hormone replacement. And I thought, holy smokes, we wouldn't even be having this discussion if I would have met you 10 years earlier, but you still can prevent jaw loss, the bone of your jaw. You can still help preserve that and preserve other bones from further bone loss by putting an estradiol level 30 into you. So you can now reverse that ability to be able to rebalance your calcium metabolism. And the importance of vitamin K, we didn't really get a chance to say that, but vitamin K is huge as far as bone health as well.
Thank you, Dr. Vicky.
Can I have one question? Can I just go to my Kaiser doctor and say I want to have the blood tested for
You can, you can, but I'll tell you, your Kaiser doctor may say, I can't do that. Okay. Now, I'm going to say this to everybody on this podcast is no, again, be your own advocate. You can order your own blood work and your first thought is, what? You can order your own blood work. You can go online and either through Quest Diagnostics, QUEST, or through a subsidiary of LabCorp called Life Extensions with an S on the end, Life Extensions. You can go online, order your estradiol level, pay for it, you get a receipt sent to you. They then tell you for your area code, zip code, whatever, where to go to the nearest draw station. They will draw you. They will ask you, where do you want your lab results sent? You want it sent back to you because now you have control of that level. Now you take that level back to your Kaiser doc and he'll go, what? How did you get this? Well, I did it myself, you know, and it may cost you $30, but you now know your estradiol level. So,
okay, thank you so much. Thank you.
mm-hmm.
Thank you, Dr. Vicky. Dr. David, I see your mic is off, and can we do that in Canada?
It depends where you are. There's more and more companies coming out, but yeah, I believe Life Labs is not in every single province right now, and that's due to bureaucracy and regulations. So it's province to province. Yeah, it's been frustrating in practicing in the US and then practicing in Canada because what I could order in the US was not even close to what I can do in Canada. And part of it's scope of practice, profession, but part of it's also just not available here yet.
Mm-hmm.
Great. Well, thank you for that. And while we're on you, David, so Cherry asked a question, is REMS a better diagnostic tool than DEXA scan for bone density? Could you comment on that?
Both of those tests usually here are going to be run through your medical doctor and then be covered in the system. So I haven't been ordering either of those for my patients. But it is kind of a good benchmark of if you're already in that point. Both tests are going to show their validity, and two, it's going to depend on the imaging centers around which you have access to. So
okay.
Yep.
And thank you, Karen. I see that you put a comment in the chat about bone density DEXA can be done privately in Vancouver. So and what do you recommend in terms of bone density tests then, Karen?
The DEXA scan is very comprehensive, and the company that I listed there, Body Comp, they also do a visceral scan. So they do a full body scan for you. You can get bone density just in the back and the hip, but you can get a full body bone density scan. And as I say, visceral fat, which is also really important, your body composition. I think right now, if you're in the Vancouver area, there's at least 4 different places. And during the month of March, I think for either the bone density or the visceral, I'm not sure, they're offering a 2-for-1. So you and your husband can go, you and a friend can go and both get a scan. And I highly recommend scanning be done. If you have some doctors, they'll poo-poo you. They'll say they won't give it to you. So if you want one, you'll probably have to do it privately, which I did. It was very helpful.
Excellent, thank you. Well, hey, I'm in for that. So if somebody wants to do that with me and join me, I'll be happy to partake in that. Another question we have here, I don't see any hands, so I'm just going to keep going here. Is Life Labs a yes or no for getting estradiol tests? Not quite clear on that. I believe so. Because I have gone to Life Labs and asked for specific tests to do with thyroid, so I can't imagine that they wouldn't do that for estradiol.
There are other companies out there that will do drop ship testing, and those are becoming more and more. So it depends whether you're going for a blood test for different hormones or saliva. But yeah, you can look up drop tests for saliva kits, and you can order those just online versus going in and getting a blood draw. There's positive and negatives to both, though. So.
Okay, Dr. Vicky, I know you have some thoughts around blood.
Well, yes, all of the European versus American research on menopausal medicine was not only difference in the medications that were looked at, but also in the methodology of how it was tested. And so the gold standard is, and all of the European research, which is a larger body of research than the American research, was all based on blood testing. And so what I would say to patients of mine is, well, I would see a number of patients that would have salivary levels drawn, and they were told by their practitioner, your levels look great, you're right where I need them based on salivary reference ranges. But they would walk into my office and say, I still don't feel good. I would do their blood levels on the spot, and they would come back many times undetectable. So there is a huge difference between salivary levels and blood levels. And my explanation to people was always, well, do you have saliva in your brain? Do you have saliva in your knee? Do you have saliva in your muscle? You have saliva in your mouth. Yes, you swallow it and it goes into your GI tract, but it's a misleading number to say you have a salivary level. And how does that relate to how your brain works or how your muscles work? So blood goes everywhere in our body. So think of oxygen and estradiol as equal. You're moving them around your body. So in order to measure it, you do either a blood oxygen level to measure it, or you measure it out of your lungs, but you also need to measure what it is in your bloodstream. Same with your estradiol, your hormone levels.
Thank you. Thank you very much.
Mm-hmm.
Karen, I have a question for you. There's somebody put in the chat. So what do you do when you're shrinking or getting shorter? Do you have any thoughts from your perspective?
Definitely attend to your posture in terms of being able to allow the spine to have its flexibility and mobility of flexion, extension, and rotations, all those movements. It needs to be able to be supple between the vertebrae so that you can find that lengthened enjoyment of the spine moving. And also in terms of your hip mobility, well, hips, knees, ankles, all the joints need to be able to move so that you can keep your upright posture.
Thank you.
And,
Dr. David.
And the balance, as Dr. David was saying, the balance between the flexors and the extensor muscles being able to support your posture upright. So it's a balancing act, as you said.
Thank you. Dr. David, do you have any suggestions for people who are feeling like they're getting shorter?
Yeah, definitely. It kind of summarizes most of what we've talked about here is that, yeah, decrease your inflammatory burden, put the right things into the system, the body that we need, breathe, because breathing is more important than diet and staying hydrated. And then you have to use these tissues. And whether it's the brain, whether it's a muscle, or whether it's the bone, they need to be used. They need to be active. So yeah, getting out, moving. And on top of that, another thing we didn't talk about nutritionally, which goes into the hormone system energies as well, is sunlight. You need to get some sunlight in there as well. So all comes down to everything that we already know that we should be doing is diet, lifestyle, nutrition, and staying active. And keep it simple and then build from that framework, of course.
I love it. And I remember,
right.
Go ahead, Dr. Vicki.
Sorry. I was going to say, if you also strengthen, and this sounds funny because I'm saying the exact same thing that David and Karen both said, but if you specifically strengthen the muscles in your back, and not just your big major muscles, but the muscles that hold your vertebra apart. And I would say to a patient, think of the fact if you don't use a muscle, it gets out of shape and it sags. So you start having your vertebra compress on each other because the muscles aren't strong enough to hold them apart. That's going to end up, think of a sponge that's wet. You press on a wet sponge and water comes out. What happens when you take your finger off the sponge will come back. So you can regain, believe it or not, some of your height loss. You can regain some of that back by strengthening those muscles between the vertebra. And there are very specific trainers that will work with you so you don't have back injury, that you can now strengthen your back and get better posture. You can accelerate everything we just talked about by working specifically on your back. Pilates is great, and Pilates will emphasize balance front and back, but some people are so out of balance, they really need to work on those back muscles before Pilates will even be able to be something that will benefit them.
Great.
Can I jump in for a moment,
Yeah.
please, Esther? Because I want to just add, you were asking about height, and you can't force your body to be upright and tall. And what's going to take priority is our internal organ systems. If you've got scar tissue, or say you've been in an accident and your heart actually can get sheared to one side, or your liver can be compressed, or various organ systems in the body will cause you to slouch, right? You can do all the exercises you want and to become taller, but the primary organs in your body say, no, I'm under stress when I come up to tall. They need to be addressed. Your internal organs need to have the mobility and motility within their structures in order for your posture to also be positively affected, or to train for that. So internal organs take priority over mechanical movement.
Thank you. That's really important. One of the things I was going to say is with Eric Edmeades, who is the leader of many things, but including WildFit. He gives people, like, if you do this 10 times for each of your each of your joints, each of your major joint groups, and you just even do this 10 times every day on each one of them, and gently and easily, that's moving your whole body all the way down to your toes, into your ankles. So that's something simple all of us can do with no equipment and none of that. And sometimes I have forgotten to do that. So this is a really great reminder to keep doing that. And I love all your suggestions. Dr. David, earlier in the chat, someone was asking about deep breathing and bone health, and you said to come back to you on that. So let's talk a little bit more about breath from what you were wanting to respond to that question earlier, please.
Right. Yeah, there's the postural component of it, the flexor component. But basically what happens in our breath is, we're taking in oxygen and getting rid of CO2, right? A little more complicated, but that's the basic premise, right? Now, if we're breathing shallowly, we breathe off our carbon dioxide, and that changes our blood pH. And blood pH is so important because, once again, it's that kind of signaling stress thing to bring calcium out of the bones and into the circulation. So if you think about it, if you become acidic, then if it was the stomach, some people will take an acid for it, like a calcium little capsule, right? And decrease that acidity. But same thing's happening in the body, is if that fluid in between cells becomes acidic, the body is going to take something out, which is calcium and other nutrients, to kind of quash it. It's a buffering system. So the easiest way to make a change to that system is, once again, deep breathing exercises versus that stressed out, shallow breathing from up top here. That only gets the top lung fields filled versus the entire lung fields with the deep breathing, where we are nice, extended back, breathing from our diaphragm, feeling that breath come up the ribs and then out. And it is circular and rhythmic when we do it properly. So adding in breath work,
let's all do that now together.
Routine is worth it.
Let's all do that now together. David, take us through one revolution of that with you.
Yeah, so just put your hand on your belly and one up top on your neck. Now, right here, right where your collarbone is, you probably feel how tight those muscles are. So if that's tight, your head's going to go forward, which is going to cause more back pain, neck pain, and then eventually structural year after year, right? So bring the chin straight back, not up, not down, straight back. You might get a double chin, oh well. And let these muscles relax. Now, when you breathe in nice and low from the diaphragm. And if you're really good at this, you're going to combine it with your Kegels and start with your pelvic diaphragm, then your diaphragm, then up your ribs. But right now, just start with your diaphragm, breathe in, feel your stomach come out and your ribs start to expand and the breath come up till you get to your neck. If you feel yourself breathing in from the neck first, then it's the wrong thing. You need to practice a lot more. And that's not a bad thing. It just tells you where you're at. Okay? So breathe in from the belly, feel it come up the ribs. And then when you breathe out, it's the opposite. Come forward. Breathe every last bit out and then rinse and repeat. You should be able to breathe in and exhale twice as long. So right now, just 3 seconds in and out for 6. And if you can keep going, you can probably be 20 out.
Excellent. Thank you for taking us through that.
Absolutely.
And I know we probably all had, I'll come to you in 1 second, Karen. We probably all breathed in and out a few times and he was giving us that first one. That's good. Okay, Karen, go for it.
I just get so excited with all of this. So talking about breathing, I think I also want to bring it back to the bones because oxygen is carried in the blood with the red blood cells, and red blood cells are formed in the bones. So we want to really make sure we have good bone health, we've got good red blood cells, that oxygen is being able to be carried through the body for all the benefits that it does offer.
Thank you. And I know we say this in every conversation that I have here. We've had 11 now on these mindful health discussions. You're going to hear it every single time. Breath, water, hydration, nutrition, movement, and what we're thinking and feeling. This is all part of our whole conversation all the time. Another question that was in here, it's very specific. It was from Rusty. Does osteoporosis leach calcium from the body and bones? Now that's one question about osteoporosis. And then another question add on is what actually, I know Vicki, Dr. Vicki, you talked about the hormones, but what causes the leaching of calcium from our bones? Does anyone have, maybe Dr. Vicki, you could start with that.
Well, the imbalance of where are you going to get calcium from? That's really what's causing the biggest source, the bone bank, to be able to be pulled out. So when you have potentially medications that are altering calcium, even when you are not menopausal, when you're altering how you absorb calcium from your GI tract, which is many times altered by, maybe you've got to acid of a pH in your stomach. So you're taking antacids, and that's going to block calcium absorption in your GI tract.
Yes.
And it's a huge problem. People don't realize that they may pop 2 or 3 at a time, 3 or 4 times a day, and you're having a major disturbance in your calcium balance in your body. So that's where the whole idea of anything gastric, whether it's celiac, whether it's gluten sensitivity, any other food allergies, there are so many instances of what can happen out of balance in your GI tract. Now we can add in the unhealthy foods with different additives in your food that you can't even pronounce it. And if your grandmother couldn't pronounce it or you can't pronounce it, it shouldn't go in your body. So that's one instance. But then there's other medications like prednisone. That prednisone and cortisone are like, oh my God, they are horrid as far. Yes, they're anti-inflammatory, but falsely and at the expense of other body systems being able to function properly. And so they will actually thin bones. They will thin and make softer cartilage that will create problems down the road. So people will willingly go in for a cortisone shot for a sore knee, but realize that 3 or 4 shots down the road, they're getting a knee replacement. Well, wait a minute, because you just softened that cartilage. And you're also raising your blood sugar with any kind of a steroid. So nothing comes without consequence. And again, balance. So if you can balance your body properly with proper diet, proper sleep, proper movement, proper balance of your 4 hormone groups, there's so much more I could throw in there, but balance is the key. Don't do anything in excess. Be as balanced as you can and respect the body you've been given. We only get one. So take care of it, advocate for it.
Thank you, Dr. Vicky. Dr. David, I know you were jumping in there.
Yeah, we could spend a week-long seminar on basically the different inflammatory issues. And with kind of the leaching out of the system, if you think about inflammation, you've heard of oxidants, right? You take antioxidants to help this out, turmeric, whatever else. Basically what's happening is those oxidative species are sent out by the immune system to go kill something. And they're acidic, they're oxygen with those negative charges. And we want the negative charges in the cells, not in the tissues in between. So it is that positive minus that inflammatory burden. But yeah, a lot of it is to look at how the gut's functioning, the immune system, all those connections, which would, yeah, be another lengthy, deep conversation as well. And I look forward to it when we do it.
Okay. We'll have to have another one on this specifically. This is great. Karen, do you have anything you want to jump in, or no? We'll keep going with questions. Okay. Excellent. So I have another question here from Sharon. For women who survived breast cancer and offered no estrogen therapies, back to Dr. Vicky here, is that 30 estradiol level achievable? And if so, how?
It is, well, I'm gonna preface that with, if your breast cancer was hormone fed. So in other words, there are breast cancers, believe it or not, that are not hormone fed. And some of the most aggressive breast cancers, like your triple negative breast cancer, is estrogen receptor positive or estrogen receptor negative, progesterone receptor negative, and HER2 negative. That one's not hormonal, but the other two are hormones. That's one of the most aggressive breast cancers. And believe it or not, I put women with that aggressive breast cancer after they go through their treatment, because their doctors would have an absolute cow if we put them on hormone while they're having anti-hormone treatment. But anti-hormone treatment doesn't help the triple negative breast cancer survivors. So that's a special case. For most menopausal breast cancer or the BRCA cancers, they are usually hormone fed because there's hormone imbalance going on. The patient that gets breast cancer in their 30s and 40s is many times an estrogen dominant person. Somebody's got fibroids, they've got endometriosis, they've got infertility, polycystic ovary disease. Those are.
Yeah, the yogurt container.
Hang on, let's. Somebody's off mute there. We could find them and put them on mute. Thank you. Carry on, Dr. Vicky. Sorry about that.
No, that's okay. It was just kind of funny. I heard yogurt and I thought calcium. So no, if you had a hormone fed breast cancer, you cannot achieve an estradiol level of 30. But it will behoove you to drop, mid-belly body fat, because your estrone will automatically make some estradiol for you. You can't take the progesterone to counter it. So you may be better off with some phytoestrogens, which are natural, and they're food-based things that you can do and supplements you can do that will help act like an estrogen. Many people with soy will get an estrogen-like effect, but North American soy is not nearly the quality of what you will find in Asia. But there is also, and I hate to say it as a med, but Evista, which is an estrogen-like, but not an estrogen med, to try to help with a lot of the major symptoms of, and is it enough for calcium metabolism? They've never done that research, so I can't answer that question for you.
Thank you, Dr. Vicky. And we are at the 11:30 mark, and we are going to keep going because there are other questions. So for those of you who wish to stay, you're welcome to do so. I'm going to end with a quote, and then we're going to come back to our Q&A section here, because it's still going strong here. And I know I want to ask a question about dairy in particular. But here is something I'd like to leave you with if you have to go. It's a quote from Og Mandino. I will greet this day with love in my heart. And how will I do this? Henceforth, I will look on all things with love and be born again. I will love the sun, for it warms my bones. Yet I will love the rain, for it cleanses my spirit. I will love the light, for it shows me the way. Yet I will love the darkness, for it shows me the stars. I will welcome happiness as it enlarges my heart. Yet I will endure sadness, for it opens my soul. I will acknowledge rewards, for they are my due. Yet I will welcome obstacles, for they are my challenge. So if you have to go, greet this day with love in your heart and take action on some of the things that you've heard here. And also, you can reach out to these practitioners. All of them are doing consultations in some form or another, and they will all do online work as well. So that information was in the chat earlier. Feel free to save the chat, and there they are again. And if you must go, blessings. Thank you for being here. And if you are staying, let's jump into another question here about dairy. Is dairy a good source of calcium? If so, what are your thoughts? You may have differing opinions. And if not, why not? David, you're laughing the loudest. Start us off.
And the reason I laugh on this is I'm a little bit of a hypocrite on this because I love how a lot of dairy tastes. But yes, it has calcium in it, but dairy is also inflammatory. And basically, it's inflammatory because all of those immune signaling molecules that a mother cow passes on to a baby cow aren't human. And yeah, there's been studies on countries with high dairy intake having more osteoporosis. And unfortunately, yeah, a lot of it does create that inflammatory response, unfortunately, which again changes where calcium actually goes in the body.
Okay, thank you. Dr. Vicky, what are your thoughts?
Well, I echo what David said. There are so many people that have an inflammatory reaction to dairy, and sometimes it's the whey, sometimes it's the lactose. There are many different proteins that are looked at when we look at even the food allergy aspect of what the GI tract and the immune system is seeing as far as what is milk and how do you break milk down, which is why you have people that are doing soy milk, or they're doing goat's milk, or they're doing different types of cheeses because it's coming from a different basis. But it's all, what does your GI tract do with that non-human milk? The only human milk we get is when we're born from breastfeeding. So every other, quote, milk product we get is foreign to our body. Does our body see it as something good, or does it react against it? Does it attack it? What is the response? And in a lot of people, it's a very mucousy response from their respiratory system, and it can cause other issues. So, it's a mixed bag.
Thank you very much. We have one more question, and Dr. David, I saw your message that you have to run shortly. We may continue for a little bit longer, but there was one here, and this is specifically probably for Dr. Vicky. Someone says, I'm finishing my 5th year on letrozole after a breast lumpectomy, and she lives in New York. Where would she go for estradiol levels tests in New York?
Well, again, I would go to, if your doctor won't do it, then either go to Quest or Life Extensions. Those
Okay.
are the two that I know you can get online. You can order yourself.
Excellent. Thank you very much.
I just want to ask, once she gets that, does she consult with you, Victoria?
She
Is it
can,
better?
absolutely she can.
Okay.
Because again, if she's on letrozole, that's a breast cancer medication. So again, what was the pathology of the breast cancer? Was there hormone receptor positive or not? And then where do we go from here? Right.
Thanks.
Right. But it's still important to know. And the reason I'll say it, and I'll say it as quickly as I can, is I had a patient that was pre-breast cancer. They did her lumpectomy, but she was a nurse working in the oncology department. So of course, what did they do is they put her on the breast cancer letrozole and whatever, even though it was pre-cancer. So I said to her, I need to know what your hormone levels are. And she laughed and she said, Doc, I'm on medication to drop my levels. They're going to be really low. I said, we don't know that till we get the levels. Now, 100% of an estradiol level, even for a woman in her 20s, is a level of 300 per perspective. I drew her levels, and her estradiol level on her breast cancer medication to drop her level was 864. And I said, holy smokes, you have to tell your oncologist this immediately. And she called the next day crying, and she said, he doesn't care. And I said, what? She said, it would ruin his protocol, that isn't a test that they look for. Therefore, they would cut me out of the protocol. And I said, wait a minute. What is more important to you, the protocol or your life? And her husband, who was sitting next to her, turned and looked at her and he said, whatever this doc wants you to do, Mimi, do it. And I said, we're going to double this medication that you're on, because you have to stay on the medication or you might lose your job. I mean, they might discriminate against you. So we started over it took 2.5 years to drop her level from 864 all the way down to less than 100. She just was a super producer. And some people are, no matter what you do. We can't assume everyone responds the same way.
Thank you, Dr. Vicky. And Dr. David, I know that you're going to have to go, so I'm cognizant of your time. Any final words? Let's do it from all three of you, but let's start with Dr. David. What would you like to leave people with today from this conversation?
I'd like to just echo the big kind of theme that everything is connected, but we can start out simply with, once again, nutrition, diet, lifestyle, sunlight, exercise in the right dosages to get people better. And then it's to build from there. And as you've heard, we can get extremely in depth, and that's the time to reach out to one of us so that we can help guide you through the maze of all of this, because it is like diving into the ocean and trying to tread water. And you're treading water faster the more that things are going wrong with you. So yeah, we're here to help and support you in all cases, from pathology to performance.
Fantastic. And David, we've put your LinkedIn, and is that the best way for people to connect with you then?
Yeah, absolutely. Or you can find me on thehardybrain.ca.
Thehardybrain.ca. Thehardybrain.ca. Just putting that in the chat right there. Okay.
Perfect.
Fantastic.
Thank you.
That's great. If you have to go, then and do what you need to do. Karen, what's your final word for us?
My premise is invest in your body, because your body is your birthright. And I want to see people getting the real health answers for their real health concerns, not just medicated or left to their own devices. And I want people to know that your physical, your emotional, and your nutritional health are synergistic. There are 3 doors, and you can go in any one of those doors, and the other 2 will automatically be supported and encouraged to do better or to regenerate. And so, yeah, I'm here to help people invest in their body and find the root sources of where finding the right health practitioner. So if you don't have self-care that you know that can help you, then having the healthcare practitioners, who to go to, and knowing if you have genetic predispositions, you have surgeries, injuries, things that have contributed to your symptoms, then need to know what those are so you can take the right action steps.
Fantastic. Thank you, Karen. Dr. Vicky.
Well, my entire practice was premised on balance. So not just the 4 main hormone groups in balance to put your body back in balance, but realize if you properly prevent, then the balance almost is automatic. And what most people are told is a colonoscopy is preventive, a mammogram is preventive. What you're still looking for is the disease. You haven't prevented anything. you have simply found the disease. So prevention is taking all of those steps 5, 10, 15 years earlier to make sure that you get that first colonoscopy. It is negative. Or you do, better yet, instead of the $5,000 colonoscopy, you do the $25 hemocult, or now they're making it over the counter where you can do stool in a little tube that you shake it with your developer and it gives you your answer. Is there blood in your stool? That's a $30 over the counter test that's coming out. CVS and Walgreens, I'm sure, will carry it. But know that you can do that for $30 starting at age 30 before you ever get to age 50 in a colonoscopy. You've got 20 years of prevention. And if you start to see an issue, well, is it hemorrhoids? Okay, is it food sensitivity? You're now brought to that question in your mind, whoa, there's a problem here. It's not cancer, but let's find out what the problem is. And now you're doing some of your own root cause before you ever get to that problem test that goes, oh my God, bells and whistles going off. Now you've activated the Western medical system. And it's like, whoa, now you're in trouble because now the system thinks that waiting too long helps them. They know it helps them. They're designed to run test after test and quote unquote get you out of trouble. Well, you can keep yourself out of trouble. It's like doing preventive car maintenance. Do preventive body maintenance. We take care of our cars many times better than our bodies. So do the preventive body maintenance. Do the simple stuff first.
That is so awesome. And that's why Mind Myself exists. Because we truly, truly, thank you. We truly want to help you become your own best health advocate by providing you information and access to fantastic practitioners like you've seen here today who can help you. And it's not too late, whether you're in your 20s, whether you're in your 80s, it's not too late to start thinking about any of these and deciding what you are going to do and what steps you are going to take to move forward. Thank you to all these practitioners who are here today. Thank you to all the guests. It has been wonderful. And we do this because you matter. Thank you for being here. We're so glad you're with us, and we're doing this because you matter.